Good morning. I wanted to update you on a couple of items today. One was the process for getting tested and our return to work process, and the other is an update on the convention center. So, in the pandemic, unfortunately, some of us are going to get symptoms and need to be tested. We'll just remind you that, of course, we don't want you to come to work with symptoms and that we do want you to call occupational health. We've tried then to make that process a little bit easier so that after you've had your test and your results have come back, if you have My Chart, you can go in and see your results, and if they're negative, you will also have the ability to go online and answer a few questions about any lingering symptoms you may or may not have. And depending on those questions, occupational health will be able to email you and your supervisor right away without you having to talk with anybody further that you are cleared to come back to work. And many of you have asked for that, and we hope this will help make that process a little bit easier. We also hope in the near future that when you call to schedule your test, we can also we can schedule you on the same call in which you called to report your symptoms and schedule the test in one phone call. The second thing I wanted to update you on was the convention center. Many of you may know that in this pandemic, the state of Maryland has opened a field hospital in the Baltimore City Convention Center run by professionals from Johns Hopkins Medicine and the University of Maryland. It is designed for patients who need 24-hour monitoring of their symptoms and some minor treatments. The use of that is going to be very important to us because we've got so many patients who need our services who don't have COVID. And so when it's appropriate for our patients to go to the convention center, we're going to tell them that it's part of the care plan for them and move some of our patients to the convention center to make room for the ones that we need to take care of at the Hopkins Hospital. And we think that's going to help us take care of all of our patients the best way we can. So you'll be hearing a bit more about that process. Finally, I just want to give kudos to our teams in the ED who've been working very hard on improving the turnaround time for ruling in and ruling out PUI patients who come to visit. They've done tremendous work, and now the vast majority of our patients, we can get those results in less than 3 hours. That's something that team has worked hard on, and I give them kudos. As we think about these videos, if you have questions or suggestions for us, please feel free to email us at the email provided here, because we certainly want these to be helpful to you. And finally, I'll just offer, stay positive, test negative.